So we're going to move on to part B, radionuclide production, facts and fantasy. We're just going to pick up from where A finished. And again, before we continue, it's really important to be very clear in this debate that radionuclide production in a nuclear reactor is not the same as energy produced in a nuclear reactor. Nuclear power reactors are a completely different story to research reactors. Their capabilities are different, it's a different debate, and it's irresponsible to be talking about them in the same I guess the same breath, even though I guess I'm doing that at this moment, is that you can't make those comparisons. Is that they're not the same debate, they're not the same capability, and as I said, it's irresponsible to suggest that they're the same thing or the same issue for the community. So the questions we've talked about previously, part A, we talked about isn't a nuclear reactor inefficient and high cost, and talked about why the Australian model is so different. Part C, which will happen after this, is whether we really need nuclear medicines. We'll talk about that. But part B, which is what we're going to talk about now, is that debate that's out there that can't radionuclides be produced in a cyclotron? And if they can, doesn't that make the reactor redundant? So I guess in brief before we start is that the answer is yes. Radionuclides can be produced in cyclotrons, and they are. Doesn't that make the reactor redundant? Absolutely not. So specifically, the debate that's out there is that there's cyclotron production of technetium-99m. Cyclotrons can and have produced technetium-99m directly. But they also produce other radionuclides. Is that in Australia we produce fluorine-18 and carbon-11 predominantly. Fluorine-18 is associated with a large number of our small cyclotrons in Australia that are specifically producing fluorine-18 because it's suitable for a certain type of nuclear medicine scan called positron emission tomography. And it only needs about 8 MeV. So that's the maximum energy of the particle you accelerate to produce it. There's 3 cyclotrons in Australia that are a little bit more energetic, that are up to 16 MeV, that can produce carbon-11. And the only one that does produce carbon-11 really is the ANSTO cyclotron that's at Mistinen Road, co-located with Royal Prince Alfred Hospital, and they do that for research. There's a whole bunch of research things rather than clinical applications. We're not producing nitrogen-13 and oxygen-15 in cyclotrons in Australia. Gallium-67 and thallium-201, iodine-123 are all cyclotron produced and used for imaging in nuclear medicine, but we don't do that in Australia. We don't actually have any cyclotrons in Australia that have sufficient energy, so that are sufficiently big to accelerate the particles, big enough to be able to produce those. So those 3 isotopes are imported from overseas, where they're produced in cyclotrons in other countries, in Europe and Canada. So the Canadians in British Columbia are trialling whether they can produce technetium-99m in a cyclotron. Now, it's really important to point out that contrary to some political and social discussion, the Canadians have not done this as their first choice. The Canadians' first choice was to replace their aging old nuclear reactors with new nuclear reactors, and in fact that they actually spent over $600 million producing 2 new nuclear reactors. And those became critical, but they failed a few technical and regulatory issues that required a large amount of money to be reinvested in them. And it got to the point where it just wasn't going to get off the ground. Is that they had these 2 enormous white elephants, essentially, where they'd spent a lot of money, hundreds and hundreds of millions of dollars that was going to be wasted. So in the end, the Canadian government drew a line in the sand and said, we can't put any more money into this project. Look for an alternative approach. So I can assure you the Canadians would love to have the same reactor that we have here in Australia as a facility for them, but they don't. And so they're experimenting with the idea of cyclotron production. There's other teams around the world doing the same thing. Luis Metello in Portugal has been doing it. I'm part of a team over there. They're working with guys in Poland and Russia and and Portugal. So there's a number of places around the world that have started to play with the technetium-99m production in a cyclotron, and I'm one of those. I'm not negative on cyclotron production. I'm actually doing it myself. So how do you produce something in cyclotron? In the previous discussion, I talked about how reactor works in brief. These are very simple schematic diagrams, but essentially what you have is you have some sort of particle in the middle, a charged particle that's going to be accelerated in a vacuum. These two magnetic, it's in a magnetic field in these two charged Ds. It's only Ds because they're shaped like Ds. This is an old schematic diagram. The reality is that now there's sort of like 4 Ds and they're more wedge shaped because it gives you greater acceleration. But that's not important. Essentially what you've got is if this is a positively charged particle and this was negative and this was positive, then obviously it would be repelled from here and attracted to there. If it was negative and this was positive and this was this was negative and this was positive, then again it would be accelerated across this gap to this point. At which time is that you would actually end up with this movement because of the magnetic field and the velocity that occurred there, the size of the radius, until it came back around here, in which case a high voltage oscillator would switch the charges between the Ds, and you would get repulsion from here, attraction to here, and so acceleration across this gap. So your particle would have a higher velocity when it got to here. So the arc would be bigger, and then the high voltage oscillator would kick in again, swap the charges, so you'd get acceleration, and progressively it would get faster and faster as it rotated around. And when it gets to this particular point here, this is how we decide the classification of the cyclotron. If the energy that the accelerated particle has when it gets to this point is 8 MeV, and that's the maximum, then 8 MeV is the range. Obviously, if it's a slightly bigger cyclotron, so it would need a bigger diameter, then you go out to say 16 MeV, which is the biggest ones we've got in Australia. And then you can get much larger ones at 30 MeV or 60 MeV. And so then that's the energy of the accelerated particle that is directed towards the target. Hits the target, produces a new product. So the example I talked about before is that the primary production of cyclotron products in Australia is associated with fluorine-18 for positron emission tomography imaging. There's 2 ways that can be done. You can accelerate a proton. The electrons are stripped and the proton hits the so if we accelerate say a hydrogen, so if you accelerate a hydrogen and then you strip the electrons off, you end up with a proton that bombards the target. So you're not actually necessarily accelerating the proton on its own. And so then the proton and the oxygen 18 have an interaction, produces fluorine-18, gives off a neutron. An alternative is that you could accelerate a deuteron, and neon-20 becomes fluorine-18 after giving off an alpha and some energy in the form of gamma. So in theory, technetium-99m can be directly produced from proton bombardment of a target called molybdenum-100, which is different to the molybdenum-99 we produced in the reactor. So molybdenum-100 with the emission of 2 neutrons at 15 MeV or more proton energy or level of acceleration that I mentioned before. Higher energies can produce higher amounts of technetium-99m, but also increases the amount of carrier and chemical contaminants. So as an example, because this is the Canadian model that is cited in the literature and social media, the Canadians have a 6-hour bombardment of a target, and after 6 hours of bombardment at 30 MeV, it produces a unit called 350 gigabecs. Now, some of you may know what a gigabec is, some may not. A becquerel just means 1 disintegration per second, so a gigabecquerel is 1 billion disintegrations per second, so this is 350 billion disintegrations per second. So it's a unit of activity. That's not all that important. The unit is 350, or the volume is 350. So that seems okay, but here are the issues. And there's some issues that, if you listen to Part A, you're already seeing. What the Canadian experience shows is it can be done, but that's nothing new. We knew that in 1970, so we've known we can produce technetium-99m in cyclotrons since 1970, and we haven't done it, and we haven't done it for a reason. It doesn't match the Australian healthcare system, so the Canadian model doesn't match our healthcare system. So there's a largely public system without the proliferation of the private sector that we have in Australia, and it's the private sector that delivers services to communities that wouldn't otherwise get them, both in metropolitan and rural and regional areas. So the geographic model that the Canadians are looking at, as well as the healthcare model, don't match the Australian healthcare model. So any of their projections are irrelevant to us. Australia has no 30 MeV cyclotrons. We have 316 MeV cyclotrons, but they're doing other things. So those, you can't just go, well, we've got 316 MeV cyclotrons, they can produce technetium. By them producing technetium, it would mean they'd have to stop doing the things that they're already doing. So the one at ANSTO, it would have to stop doing all the research that it does. That's not what it's designed to do. And then, of course, there's one in Adelaide, and it's producing fluorine-18. So it's not a model that we can just instantly go, well, we can actually adopt. We'd have to create the infrastructure to do it. Let's also look at what they've produced. After 6 hours of bombardment, they produced 350 gigabecs of activity. Now, that would provide maybe 4 departments, 2 or 3 if they were busy departments. So if you looked at the Sydney or the Melbourne model, that would be about 2 or 3 of the big teaching hospitals in Sydney or Melbourne. In reality, the production produces chemical carriers, and so you end up with a product that requires a number of quality assurance steps, and that can take a number of hours. So if you actually looked at the Canadian model, they talked about 3 or 4 hours of manipulation of the product, and so it undergoes decay because we're not dealing with molybdenum-99 here with the 67-hour half-life. We're actually dealing with technetium-99m with a 6-hour half-life. So 3 or 4 hours of manual handling reduces that 350 gigabecs to 200 gigabecs. So that's not going to go very far. We haven't even shipped it out of the department yet, or out of the facility yet, and so this is probably going to supply 2 teaching hospitals at the most. The problem is even after this process, the purity levels of technetium-99m would not pass the current TGA requirements for commercial standards. So it means that if this was to work in Australia, there'd need to be extra time and extra cost added so that this product could actually meet the standards for commercial use in humans. And that further decreases the activity because of that 6-hour half-life. And that further decrease in the activity, you've not only increased your costs associated with doing the extra quality control, but you've also increased your cost because you've got less technetium in there at the end. So this 350 gigabecs in reality would end up being in the order of 100 gigabecs, and even less once it was shipped to the departments. If it was a department that was 1 hour away, then it would be only 90 gigabecs. So can the reactor be made redundant as a result of this? Now, this is what the current political and social argument is, that because we can produce technetium-99m in a cyclotron, people are suggesting that, well, maybe we should, and we should close down the reactor. Now, what that debate neglects, these are the assumptions that completely neglects. It ignores the multiple radionuclides that are not technetium-99m that are produced in a reactor. So all we're doing is producing technetium-99m in a cyclotron. We're not all of a sudden producing those therapeutic agents like lutetium-177, like samarium-153. So it doesn't replace those. Diagnostic agents like iodine-131, which also has a therapeutic application. Those things are not going to be produced in other means. They would go by the wayside. It also ignores those products that are actually not only fission but neutron activation produced. It ignores the knock-on effects to other communities like New Zealand and Southeast Asia that rely on the reactor. Those countries, well, New Zealand doesn't have a reactor, we export to them. We have that commercial partnership. It ignores the fact that we do not have the expertise to man this solution. So at the moment, we actually have a centralized expertise at the reactor. We have all the radiochemists, the technical people, the physics people, the commercial people, the management people. All of those people are all in one facility, and that creates enormous economies of scale. So if we're going to decentralize that, so each community has a cyclotron to produce its technetium-99m, and it has to have these rigorous radiochemical purification processes and pass quality assurance mechanisms, we've got to decentralize that. We don't have the manpower to be able to have that many cyclotrons with that much staff. It ignores the enormous increase in daily road freight. Remember, the generators are transported once a week. All of a sudden, we'd actually have to have daily and sometimes multiple daily deliveries of radioactive material on the roads. It ignores the fact that cyclotrons have their own waste. We talk about the waste associated with a reactor. Well, cyclotrons will have their own waste. It ignores the fact that cyclotrons do not provide an on-call solution. So what that means is that when you get your delivery in the morning, that's the activity that you've got. If a patient comes in at midnight because they've got a gastrointestinal bleed, then you don't actually have the activity to be able to do the scan. You can't offer weekend work unless you've got a cyclotron that's also working 24 hours a day and over weekends, or doing 2 runs a day every day, so that you actually get a second batch of technetium at the end of the day just in case you need it. If you don't need it, well then that was a waste of time and money, not just for the department, but for the team that was employed and the costs of the team employed to actually do that production run. So you lose all of that flexibility. It ignores the fact that the actual ANSTO generator itself creates its own quality assurance system, because you actually elute it off. So it leaves behind any chemical carrier. It means that, so it reduces that cost. It means it has its own built-in pyrogenicity filter, which you don't get. So it's actually very good. The ANSTO generator creates its own economies as well. It ignores that there's no alternative revenue stream to offset production costs and maintenance costs that the reactor has. So the commercial aspect of silicon irradiation, the research associated with the Bragg Institute, and all of those things reduce the overall cost. They offset the cost. You would have no offsets in a cyclotron model. Every dollar that it costs to set up the infrastructure, the man hours associated with the production, the cost of production, the cost of shipment, the cost of downtime would all be absorbed by the cost of the end product to the patient. And as a result, it ignores the tax implications. Is that the ANSTO facility is a central national facility, so it comes under the national taxation system. So if all of a sudden we had community-based cyclotrons producing community-based or community-led needs of technetium-99m, then why should that not be a community-based burden financially? And if that's the case, then all of a sudden it means that you'll have communities that are well off, being well serviced, and communities that are struggling actually having a lower level of healthcare. Australian geography and population dispersion does not allow us to simply lift the Canadian network model in. It would mean that we'd have to have an enormous amount of cyclotrons around the country to provide that solution. And it overlooks, for want of a better term, community redundance. It means that in an individual community, can you sustain 2 cyclotrons? If you can't sustain 2 cyclotrons, then what happens when the one cyclotron that your community can sustain needs to undergo maintenance or it breaks down? Does that community then go without product? But it could be done. Okay, so it could be done. And so what I'm presenting here is how we would go about doing that. Okay, you'd have to have 20 MeV cyclotrons. There's currently none in Australia, dedicated purely to the production of technetium-99m, at a cost of around $30 to $50 million each startup. It could be more. That doesn't include ongoing costs of staff, maintenance, product to produce, shipping. Doesn't include any of those costs. That's just the building facility and the equipment. You would need 5 of those in Sydney Basin. You would need 4 in Melbourne, 3 in each of Brisbane, Adelaide and Perth, at least 1 in each of Hobart and Canberra. And so you'd be looking at probably close to $1 billion just in infrastructure costs alone to service essentially just the cities. So when you actually looked at our regional communities that have nuclear medicine services, they would need 16 MeV cyclotrons and you could probably double up. You could probably actually have them, concurrently producing F18 for PET and technetium-99m, but you'd be looking at about $15 million startup costs. And again, that's without the ongoings associated with staff. So then I've just listed all of the cyclotron locations you would need in Australia. And it's a large number, and as there's growth, you would end up with more. So you'd be looking at another $450+ million. So realistically, probably about $1.5 billion to just build the cyclotrons that we'd need in Australia. What that doesn't do is answer these questions. What's the cost of training and relocating appropriately qualified staff to run the facilities? The chemistry team, the IT team, the physics team, the technical team. What's the cost and risk of the increased road transport daily? What's the backup plan for those local cyclotrons when there's maintenance or breakdowns? And the big question is that we currently have cyclotrons in Australia that are producing PET radioisotopes to rural and regional Australia. So if the current rural and regional PET departments who rely on cyclotron productions can't get equitable, and when I say equitable, it's not only supply, but it's the cost of supply, and reliable supply now, why would the more complex and numerous technetium-based cyclotron infrastructure not create the same issue but magnified, creating a 2 or 3-tiered healthcare system in Australia? So in summary, the Opal nuclear reactor only costs $400 million as a centralised national facility, and it's a world-leading facility. So we could build 4 Opals for the cost of a national cyclotron network. And even when we actually built that national cyclotron network, we'd still fall well short of providing the equity of service delivery, the cost and the convenience and flexibility that the ANSTO generator system provides. So it still wouldn't provide the solution that we have. So in reality, the network outlined in the last few slides would never be constructed because of the cost, because of the redundancy. And so the provision would fall well short of what's currently afforded by ANSTO. Even with that network, it would be well less than what we get with ANSTO, so it would be even further behind. Furthermore, the dollars per megabec of technetium-99m through cyclotron production would be significantly higher, order of magnitude higher, than the Opal reactor. So you need to add that to the tax burden of the infrastructure and the increased cost of transport. So some significant cost, and with that cost would become availability. So what would happen with the cyclotron network? The real cost would be that would decrease the health and well-being of every Australian. Now, I'm not suggesting that there's no role for cyclotron production of technetium-99m. There may be some niche roles in niche communities where they can actually show a cost-effective model over the existing supply chain through the Opal reactor. Given the numbers, I would find it very difficult to be able to justify that, but there may be a role. There may be a role in offsetting the footprint associated with exporting of molybdenum overseas, but it can't replace the reactor. Opal is a cheap and efficient solution that offers flexible service delivery and world-leading capability. Cyclotrons can produce technetium-99m directly, but the costs associated with the infrastructure, maintenance, production, staff, transport, and the end product are significantly higher. The reliability is lower, the quality is lower, and the service is substandard to the end user in terms of its flexibility, and the end user being the patient as well as the clinical site, and will create a 2 or 3 tier healthcare system in Australia.